Welcome to Adapting NCLEX. This is Management of Care as part of our series on Ultimate NCLEX Review. These are collections of videos recorded in a bite-sized form, giving you concept for each content area that is tested on the NCLEX. They are on the playlist. Check Adapting NCLEX and then watch them. I've done a couple of them. Before that, just want to talk to you about our channel. This is Adapting NCLEX. We have Gold and NGN Gold membership. This is a small token to support the channel. We have a free review live on YouTube on Wednesdays at 5 p.m. Eastern time on YouTube. Just log into my channel. You see me there. Or usually I come in 5 to 5:30. So if I'm not there 5, just come back 5:30. On Saturdays at 3 p.m. it's on Zoom. That's the Zoom ID and passcode. We also have a course. If you want a course and you're running out of time, you want to study in a precise, concise way, we have a course. Is on demand with content associated with the large Q bank, over 2,000 questions in the Q bank already I've written. And therefore, you can check it and see if you like it, but you will never regret when you touch Adapting NCLEX and Q bank in addition to the on-demand. So let's get to it as we learn something on management of care. And these questions are principal concept. A little bit of it, 9 questions, but I bet you when you finish watching this video, you would know that you know a bunch of stuff relating to management of care. What is the first thing? How do you answer the question? From the back, which client assignment is most appropriate for the float nurse? There's a principle associated with the float nurse. What should a float nurse do? They can take care of patient, but you should not give them any specialized patient. 2, they are not involved in admission, right? 3, they cannot be involved in what? Discharge. And 4, any new patients, they should not take care of it. You should give them patient that is perfect for their background. Even though they are nurses, give them something that is perfect for their background. So what is the problem? A nurse from the pediatric unit is floated to the medical surgical unit. It's a ped nurse. So give them something that a pediatric nurse should be able to take care of. A client admitted with DKA requiring hourly blood glucose monitoring. Of course, sometimes they have patients with DKA, they can take care of it, but it's not specialized for pediatric units, right? DKA is a medicine problem. Even though you can have peds with the diabetes, I don't think that's appropriate. A client with new tracheostomy requiring what? Frequent suctioning. That's a specialized treatment by a medical surgical unit nurse. A client 2 days post-appendectomy on regular diet. Just had surgery, remove the appendix. Oh, any nurse can take care of a patient who just had surgery and you remove the appendix. Appendectomy is common, whether kids or older patients, and patient is already eating. All they need to do is just give the kid food. A client with chest pain awaiting cardiac catheterization scheduled for later today. Cardiac catheterization, it's a specialized treatment, right? The nurse has to teach them pre-operative findings and then post-operatively what you watch for. A nurse from a pediatric unit is not suited for that. So for this patient, number 3 is the right answer. 2, a nurse is functioning as a client advocate. So which actions demonstrate a client advocate? An advocate is the one that is going to force for client's right. It's going to force for client safety. And he has to inform that the patient is aware of any procedures that is done. So informed consent. Just recommending things is not enough. You make sure the patient get the need that they need. So yeah, their right, all right, and safety is ensured to the patient, right? Informing the client about their right to refuse treatment is advocating. You're advocating for them, right? Reporting a co-worker suspect of diverting narcotic, that is safety. If the individual is diverting narcotic, when he used the narcotic and now he has to take care of the patient, is impaired. That is good. Recommending a holistic approach to pain management. Holistic, even though it's good, it's not enough. Just recommending is not enough. Ensure that the patient does have pain management. Pain management is patient right to have the pain management. Recommendation is not enough. Reassuring the client that the surgical error will not occur again. That is a promise. It's not an advocate. Ensuring that the client can ask the healthcare provider questions before signing what? Consent, informed consent. So what are the answers? As you can see, straightforward, right? Patient's right. Excellent. Reporting the co-worker. This is a safety one. Just recommending is not enough, right? Ensure because pain management is an individual right. Reassuring the client is promise. We're not supposed to do that. And this is informed consent. So 5, 1, and 2 are the right answer. 3 and 4 are not. So that's the second one. So 3 and 4 are not. Which client should the nurse see first? Prioritization is a management of care. You know, I've done a bunch of prioritization. By this time, if you watch adapting class, you should be on your way mastering B sharp moment, breathing issue, electrolyte shock, sepsis, airway, and then neurological problem and pain. Every prioritization, ask yourself, do I have to be sharp or right? But don't be expected. So if it's an expected finding, you let it go. And the B sharp means you check if it's a breathing, check if it's electrolyte shock or sepsis. They're not going to tell you, but look at the situation, flip it back and say, oh, this is a breathing issue. I should worry about it. This is not what I expect in the individual. What is the problem? 4 patients. What do they have? 1, fractured arm. I'm having pain, 7 out of 10. If you broke your hand, you're going to have pain. In the B sharp, we have pain. Is this pain going to make you lose your limb, life, and eyesight? I don't think he's losing his limb. He just had a fracture there. There's no evidence on compartment syndrome. You ignore it. This is how you do prioritization with the B sharp. A client with laceration of the forehead requiring suture. He has a wound, okay, he has a head injury, something like that. This is not neurological problem. It's not lethargic. He has trauma to the head, but there's no evidence of neurological problem. Just laceration for the forehead. I ignore it. You see how B sharp is powerful? A client with chest pain and what? Diaphoretic. Chest pain and diaphoretic. This is what? Diaphoresis, when you have diaphoresis in your chest, probably you're having airway anger problem. Or you have what? Chest pain. It may be cardiac origin. You can be in shock or diaphoretic. So there is a C there, and then so shock, and there's the airway issue there. So all of this telling you something is wrong. A client with ankle sprain requesting ice pack. Same thing. Pain, pain, pain. It's not going to kill you. So number 3 is the right answer. Which scenario required the nurse to intervene when informed consent is being obtained? Informed consent means informed consent. Inform me to the point that I understand it. I should never be impaired. It should not be coerced. I have to make my own decision. I have to understand it. You have to talk to me in the layman term. I have a video I just did recently on my YouTube. You can check it on informed consent. All the principles, or I have a comprehensive one that encompasses everything on ethics and then informed consent. So check it out. But these are the principles and the backbone of informed consent. A client signs the form after receiving what? 2 milligram of lorazepam. Client is impaired. Nurse need to intervene. Healthcare provider explain the procedure in medical jargon. No, in simple layman term, nurse need to intervene. The client is unable to verbalize the risks of the procedure. That means he did not understand, he or she did not understand the information provided. 4, the healthcare provider obtain consent from the client's spouse. It's called informed consent. Patient is supposed to do that unless the patient has delegated that responsibility to the spouse. No, there's no evidence in that question, so we got to intervene. The nurse witnesses the client signing the form after the provider explanation, or the nurse that is witness and saw that the patient was provided enough information, he signed it without any problem. Which one did nurse intervene? 1, 2, 3, and 4. So 5 is right. A terminally ill client refuses artificial nutrition despite family request to initiate feeding, right? It's on the death point, he's on the point of dying, and he's refusing artificial nutrition, which is normal. Anorexia is normal, getting to the end of life, right? What ethical principle is the nurse upholding by supporting the client decision? What is he upholding when you support the client to refuse nutrition? To tube feeding, like artificial feeding, beneficence, non-efficiency, autonomy, and justice. You're supporting for the patient, you're advocating for the patient, you're ensuring the patient is making the right decision. What do we talk about? And the advocacy is what? Making sure the right of the patient is ensured, making sure the patient has informed consent, and providing safety. Informed consent, this patient that want to make sure he does not want any artificial nutrition. When you support them, you're giving them autonomy, right? So there's no justice here. It's not between two people. You're not doing any harm or good to the patient. All you're doing is advocating for the patient, and that's in the form of autonomy, like make his own decision. So 3 is your right answer. Which task can a registered nurse safely delegate to an unlicensed assistant personnel? I said, me, the way I think about it is UAP, anything that does not require thinking. I'm not saying they don't think. They are good people, they understand, but for your test, hey, in order for me to understand what tasks can be delegated to them, I always say nothing requires thinking, right? I'm measuring vitals on a stable patient. I'm not going to think. I take the machine, check the blood pressure, temperature. That's all. There's no assessment. There's no evaluation. That's what I mean. No thinking. Assisting the client with bed to chair transfer. Just transfer them to bed to chair. Right? There's no major big assessment, even though you say, oh, they have to look at the table. When you're doing that, you're losing the point. Instructing a client on incentives parameter. You see the word there, instruction. I'm teaching you. They're not supposed to do that. Documenting intake and output. How much did you eat? How much did it come out from the folate? Does not require thinking. Performing a sterile dressing require thinking. Got to make sure, assess the wound, and make sure everything is okay. Therefore, which one? Measuring vitals, assisting the client to better, and documenting intake and output. So 1, 2, and 4 are your right answer. And this is assisting in a disaster triage situation. Which client should the nurse save first? In a triage situation, you save those you can save. If you have a lot of injury, good luck, you're going to die. How did you find the best answer? Go for the black and red. Forget about yellow and green. If you see the black, ignore it. If you see the red, pick it. What are red? Chest injury, shock, right? Those are the key aspects. Any chest injury or any amputation that is bleeding, right? Unstable wound, right? So look at it. This is a strategy. A client with open fracture and no pulse distally probably has bled to the point that it may be in shock, right? A client with second degree burn over 50% of the body surface. This guy is going to die. You can't save him. 50%. Half of the body is burned, is dead, is black. A client with penetrating chest wound and severe respiratory. I told you chest wound is always a priority. And I have respiratory distress, probably have pneumothorax. Small laceration and no injury. Don't worry about it. It may be yellow, right? So, or green or something like that. But I don't care about it. The only thing I care is red and black. And so 3 is the right answer. And this is working on a medical surgical unit. Which task is appropriate to delegate to the licensed LPN? LPN, I call it MMR most. That is the thing they can do. MMR most. I know you may have a list from here to Germany about what LPN would do, but I don't have it. All I have is MMR most, right? They can give most medication. That's what it means. Most medication, right? I'm not going to list all the medication. They can monitor. That I only emphasize with the adjectives, right? Monitor things. R, reinforce things. The same thing. Most medication. Or they can take care of stoma, any stoma. Colostomy, ileostomy, gastrostomy, tracheostomy. S, they can do some special tests like neurovascular check, right? Respiratory, listen to your lung and bouncer. And T is 2 feet. That's all. They are not involving blood transfusion. They may monitor the findings of the RN, but they're not administering the blood transfusion, right? Performing a focused respiratory assessment, right? Think about it. Performing a focused respiratory assessment. They don't do any assessment, right? They are not responsible for assessing the patient, right? They may monitor those findings, educating a newly diagnosed diabetic patient about what? Insulin injection. They are not involved in educating them, right? They can reinforce the education. Reinforcing discharge instruction is better than two. Somebody say, well, they can listen to them. This is an assessment, right? That's what they can do specialized test, but this is different. So reinforcement of digital teaching is the most appropriate to delegate to them. You see how it works. So if you know it, it's easy. And then last one. And then from the psychiatry unit is floated to the medical surgical unit. Which client assignments are appropriate for the float nurse to accept? She needs to just do basic nursing care, anything specific with the psych specialist specialty, but the rest of it, just ignore it. A client with schizophrenia requiring assistance with bathing and eating, a psych patient, give to the psych float nurse. A client on contact precaution for C. diff requiring frequent leading changes. Nurses, all you do, you're very good and specialize in changing linen. This is not big problem. Every nurse should be able to change linen. This one is appropriate. A client 2 hours post-operative after a total hip replacement requiring neurovascular check. I know she's the nurse. She's a psych unit nurse. She doesn't do vascular check, especially in a hip replacement patient. No, don't give it to them. A client receiving IV heparin for pulmonary embolism requiring frequent laboratory monitoring. You got to do your PTT and all those drawing labs and monitoring, titrating the heparin drip. No, this is not good for a floatiness. A client with mild dementia requiring assistance with meals and redirection. It's a psych patient with dementia. They see them all the time. They can redirect and then give them food. So 1, 2, and 5 is appropriate for a psych unit. This is 9 questions, but I'll focus on every aspect of management of care. I hope you get something of it. If you like it, click on the link below and then join our adapting class or join our membership on our crash course. Take care of yourself and share the video if it's beneficial to you, and bring if you've not subscribed, subscribe to adapting class and more memes to our channel to get the content you're getting. Take care of yourself and good luck.